this is Dr. Nikhil. I am the Chief Neonatologist at Aster RV Hospital, JP Nagar. Today I will be talking about neonatal jaundice. So what is neonatal jaundice? Neonatal jaundice is nothing but yellowish discoloration of the eyes and the skin. In newborns, we look mainly at the skin of the babies, starting from soon after birth till at least up to 15 days of life. So this is the time period wherein the jaundice levels can go up. So what are the causes for the neonatal jaundice? The most common cause is what we call as a physiological jaundice, wherein the jaundice level, the bilirubin level goes up from day 0 of life till up to around 10 to 15 days of life, and then it starts to come down slowly. The main reason for this is the immaturity of the liver, wherein most of the metabolism of the bilirubin or the jaundice level happens. So this is most common for the full-term babies. If the baby is born preterm, then we have to keep a watch for a longer duration of time. The other causes are not that significant because we don't see that often. So that can include some familial genetic causes. There can be high increase in the bilirubin because of hypothyroidism also, and so on and so forth. We also see something called as a breastfeeding or a breast milk jaundice. So breastfeeding jaundice is most common in the first week of life. In that, we just see that the dehydration or there is significant weight loss accompanied by increase in the bilirubin levels. Breast milk jaundice is something which we see after 2 weeks of life. Sometimes once the baby is exclusively breastfed, the jaundice levels might go up. The only treatment that is required for this is to stop the breastfeeding for a few days, but this is not a decision that we take lightly. So how to recognize that there is some neonatal jaundice? So there are multiple ways. For clinicians, that can include what we call as a transcutaneous bilirubinometer. So this is a new machine wherein we can check for the bilirubin or the jaundice level without resorting to taking the blood sample. So this can be done after 1 or 2 days of life till around 3 weeks of life. There is an excellent correlation with the blood levels between 5 to 15 milligram per dl of the bilirubin levels. Anything above 15, we have to unfortunately go in for a blood test again. For the parents, the most important thing to note is about how the feeding is happening and any yellowish discoloration which they are really concerned about. We also get multiple times the questions whether the sunlight is really helpful. My answer to that will be typically that sunlight is much more useful to get vitamin D for the baby rather than for the jaundice, for the reasons that I'll explain further. So what are the red flags in neonatal jaundice? Like I mentioned before, most of the times the jaundice is not that significant that we have to worry about it. But definitely there will be some red flags. The first red flag is if the jaundice appears within day 1 of life, that is within 24 hours of life, or if it's increasing significantly, or if it's increasing even though we are keeping the baby under treatment, or if the baby is extremely preterm, or with any other medical conditions along with jaundice, for example any infections, or if the baby has any other deformity, etc. So what is the treatment for neonatal jaundice? Most of the times it's just observe, make sure that the feeding is going on well. In case the mother requires any help with the feeding, to help with that, and to keep on monitoring the same. In case the treatment is required, if it goes above a certain value, then we give the treatment and with what is called as a phototherapy, wherein in common parlance we keep the baby under blue lights. The baby is fully naked except for covering the genitals and the eye area. This treatment is given for a minimum of 24 hours, and after which we do a repeat blood test to check for the jaundice levels. In the meantime, in case it is required, we do some other tests to check whether there is any other abnormalities that we can think of. In case the jaundice level goes up significantly in spite of phototherapy, there are other treatments available which can include exchange transfusion, wherein we change the whole blood, or IVIG, which have a very specific use case scenarios. So we at Aster RV Hospital have a full team of neonatologists and a fully functional level 4 NICU, which can take care of the baby in case there is any other complications accompanied by neonatal jaundice. Also, we have a full team of fully trained nurses and feeding counselors who will take care of the feeding as well as the other parameters which have to be checked. So for this reason, you can very well rest assured and choose Aster RV for taking care of your baby.